Ladies and gentlemen, thank you for standing by. Welcome to the How to Energize Your Coalition webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. As a reminder, this conference call is being recorded Wednesday, July 9, 2014. I will turn the conference call over to Rochelle Seeger. Please go ahead.
Thank you. Good afternoon, everyone. Thank you so much for joining us today. I'm Rochelle Seeger, Community Health Research Officer here at the Foundation for a Healthy Kentucky. This webinar is a part of the Foundation's Health for a Change training series. This free series is comprised of webinars and in-person workshops designed to support the efforts of Kentucky's community health coalitions, agencies, health advocates, and interested community members. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet healthcare needs of Kentuckians with three main focus areas. Promoting responsive health policy aims to make public health policy more responsive to the health and healthcare needs of the people of Kentucky. Investing in Kentucky's future aims to improve the health of Kentucky's children by engaging communities in tested, innovative strategies. And finally, supporting communities aims to support implementation or expansion of these strategies to improve the health of Kentucky's lower-income communities. The Foundation does this by grant making, supporting targeted health and healthcare-related research, providing policymakers with the information needed to make decisions which impact the health of Kentuckians, and finally, by offering training and technical assistance through events just like this one. Next, I want to direct you to the Foundation's website. There you see a lot of information about the Foundation's initiatives, and you can also listen to the archives of past Health for Change training webinars. Reports and issue briefs of the Foundation are also posted there. On today's webinar, I'm honored to welcome three community leaders at work here in Kentucky. They will share with us their experiences on how to build and maintain coalitions in their communities. As our moderator mentioned, you can submit your questions via the chat feature. I'm thrilled to welcome these fantastic speakers today. I'm really looking forward to a great discussion and presentations from each of them. To begin with, each will make a brief introduction, and I welcome Anita Courtney to the call.
Hello, everyone. I am Anita Courtney, and I am the chairperson of the Tweens Nutrition and Fitness Coalition here in Lexington. We've been together for 11 years, and our mission is to help make physical activity and healthy eating both popular and accessible for tweens in their homes and their schools and communities. Tweens are the 9 to 13-year-old demographic, and though they are our priority audience, we also do a lot of work with their primary influencers, their parents, school administrators, and community leaders. Three projects that we're currently working on I'll just share a bit about. The first is called Better Bites, Snack Strong, and that started in 2010 at the Lexington pools. In just 4 years, we've gone from having their concession stands have only one healthy item on the menu, and that was bottled water, to now 64% of their items meet our Better Bites nutrition guidelines. From there, Better Bites Snack Strong has spread to sports venues, after-school programs, the state parks, restaurants, and soon some Kentucky government buildings. We also do work on a project called Good Neighbor Stores, and this is helping small stores in underserved neighborhoods stock and promote more healthy food and also become cleaner, safer, and more engaged in the community. The final project I'll tell you about now is our school wellness policy work. We are currently working to promote a district-wide school wellness policy in Fayette County schools, and it would do three things if passed, and that is not allow the use of food as reward for academic performance or behavior, prioritizing recess, requiring that elementary school students have 20 minutes a day, and also including healthy food in celebrations. So I'll tell you one more thing about our coalition right now, and that is that we use an operating system called community-based prevention marketing. And this is a method that takes a good old-fashioned coalition with its influence, its wisdom, its connections, and combines it with the sophisticated tools of social marketing. And this has served us well for the 11 years we've been working. It involves doing a lot of research up front, a lot of testing of our work and evaluating and monitoring to make sure that it's going well. So I'll pass to Lacey now.
Welcome.
Hi,
Lacey.
everyone. This is Lacey McNary, and I work with Kentucky Youth Advocates, and I also direct the Kentucky Oral Health Coalition, which is a project of KYA. I will get into talking a little bit more about the various coalitions that Kentucky Youth Advocates works on a little bit later in the conversation. But Kentucky Youth Advocates is almost a 40-year-old organization. We do multi-issue, state-level child advocacy work. And pretty much, whenever there's a children's issue going on in Kentucky, we like to know about it and help influence it. I have been at Kentucky Youth Advocates myself for 12 years, and coalitions are a big part of our theory of change here at Kentucky Youth Advocates. So we know that in order to get things done, you have to have a committed coalition behind the effort. So we have been involved with lots and lots of coalitions over the years, learned what has worked, and I'm sure like most of you on the call have learned some things that don't work over time. And I'm really happy to see several fellow advocates on the line who probably would be able to share lots of wisdom yourselves as well. So hopefully we'll get into some great conversations towards the end of the call, and I'm looking forward to it. Thank you so much.
Thank you, Lacey, and welcome, Peter.
Hi, my name is Peter Hille. I'm the Executive Vice President of MACID. That's the Mountain Association for Community Economic Development in Berea, Kentucky. I oversee MACID's work in energy efficiency and renewable energy projects, sustainable forestry, and also our work around enterprise development, which includes providing capital and technical assistance for small businesses in eastern Kentucky. Prior to my work here at MACID, I was the director of the Brushy Fork Institute at Berea College, and during my 22 years there, I carried out programs in leadership development and community development across Central Appalachia, as well as coordinating some national initiatives for the Kellogg Foundation and a few international projects. And I'll actually be drawing on one of those international projects to share some lessons about coalitions later in the call today.
Thank you, Peter. I'm looking forward to each of your presentations and the discussion. And now I'm going to turn over the controls to Anita Courtney. She'll give us a little bit of the details on how she does all the work that she does with the Tweens Coalition. Welcome, Anita.
Thank you, Rochelle. I'm going to talk about some very basic elements of running a coalition. And some of these might sound elementary, but in my experience of serving on coalitions and leading coalitions, I find that it is some of these small things that really can make or break the success of a coalition. So here's the plan for my 15 minutes. I'm going to talk about the power of coalitions, some elements of good leadership, how to recruit members so you have the right folks at the table, and then once you get them there, how you retain them, and then the bottom line of what we all want to do, and that is get stuff done. I think Helen Keller says it the best, alone we can do so little, together we can do so much. In my 35 years of doing public health work, I've flown solo some, and I have done coalition work, and I can say that the impact that I've been able to have has been so much stronger when I've had the support of others working with me. Quickly, just a few advantages of working as a coalition. What gives it this power that we all are talking about? The first is it sets you up with just an automatic infrastructure for communication. You know, if you have people all across the state or across your town working on things, but they don't have a regular means of communicating, all sorts of things can be going on that the others don't know about. So a coalition ensures that you stay in touch. Of course, it helps with coordination, and again, it's very easy for people to be duplicating, for there to be fragmentation if you're not joined together in some sort of format. And then, of course, the collaboration. When you get a group of people together, your visibility is so much better. your credibility is stronger. You're not just one lone ranger. You've got a lot of people beating the same drum, and you start to have more power and more effectiveness. Even though a coalition has all that power, it doesn't mean that we should all automatically run out and form one for everything we do, because it's a big endeavor. So I think before starting one, it's good to sit down and ask, does your problem lend itself to a coalition effort? Is there already someone working on this? And if there is, if there's any way you can join them rather than splintering off and starting a new group, that will not drain the power from the effort that you're doing. And I think the most important question is, do you have enough resources to support it? I think we've all been in groups where there's not enough leadership or staff to do the background work. And you bring all these people into the room, but you don't have the support to harness that power that they've got. So you need to have someone who it's their job to really be looking out for the well-being of this group, and that you've got some funds too in most cases. You can do it without funds, but it sure makes it go better with some. So what makes a good coalition leader? The first is creating vision, really helping people see what just could be possible, what things could be like in an ideal situation. A leader has to engage people to join the effort. To keep a group on track, it's very easy to get off on tangents, but a good leader will keep you marching in order. A good leader will guide but not control. You don't want a top-down sort of system. That will not get you very far. And then also framing the issue so the group can make clear decisions. You know, when you have those meetings where people are going around and round in circles, someone to come in and distill what the conversation is about and help people make a good solid decision that they can all stand behind. Also, you know, anytime we get groups together, there's likely to be some conflict and turf issues. A good leader can be watching out for that, maybe having some conversations behind the scenes, maybe mediating a bit. Also, drawing those quiet members in. I think sometimes they're the smartest and they're sitting on the gem that we all might need to hear. Delegation is really important. I can remember being in a group where the leader just did everything. And so since the other people weren't engaged, the effort didn't go very far. And then the leader also is ensuring follow-through and celebrating the accomplishments. So how do you get the right people to the table so you can get the work done? It's good. When we started the Tweens Coalition, we actually sat down and made lists first of categories of people we wanted represented. Then we actually put names into those categories, and then we sort of weighed the pros and cons of invitations to different members. It's also very good to get members of the group that you hope to serve on your coalition. And for us, that is tweens, the 9 to 13-year-olds. And we started inviting them to our meetings, but as you can imagine, their schedules were different than ours, and they were board stiff. What we ended up doing is forming a tweens advisory group so they could meet at a time that worked for them. The meetings were a lot more raucous and loose and fun, and we got their input to that format. So that is certainly one option. So what kind of traits do you want to look for in members? Certainly people who have influence and power. When we first started, we had the former mayor on our coalition, and she had so much influence and had so many connections. She was a big help. Look for people who've had good track records, people whose work you've admired, because they're likely to be able to do the same in your group. You might look for some specific skills, someone who's a good writer, a good graphic designer, good at working with the media, somebody who can make connections for you, and those people who have good direct communication skills. They can save a group. Then there are types of contributors. You know, those people who can generate, 40 ideas in a half hour, you want some of them on your team. They're not likely to be the people who will do the work. You need the worker bees for those. Those are the folks who probably like to be behind the scenes, but they're doing a lot of the nuts and bolts work. Butterflies, those people who do cross-pollination. On the Tweens Coalition, we actually had a member whose daughter dated the head of concessions at the Lexington Legends ballpark, and she was able to connect us to him, and they joined Better Bites Snack Strong and actually serve those snacks in their kids zone now. So all that connection really helps. And then if there are people who have access to resources, a good meeting room, maybe some free printing, maybe even some funds. So how do you go about recruiting? I'll tell you the method I used, and I'm sure there are many, many other ways. I began by writing the most compelling letter that I could about why we wanted to start this coalition, why it was important, and what the vision was, and what the power could be. And then in the envelope, I tucked an exercise band, just something to get their attention in this information age, so maybe they'd actually open it and read the letter. And then in this letter also, I talked a lot about what's in it for them, how it would enhance their work, networking possibilities, belonging, being on a coalition is like being a part of a tribe, and how satisfying it is to be a part of the solution. The next thing I did was follow up with a phone call and let them have that letter for about a week so the call wouldn't come out of the blue and they had a chance to think about it. On the call again, I shared my vision, and then I told them why I wanted them on the coalition, and sincere flattery works. And then I asked them what did they like about being on a coalition and what didn't they like. And I took notes and I incorporated it into the way we operate. And this is what the Tweens Coalition members told us in the recruitment phase, that they wanted to accomplish something, to not spin wheels. They wanted good leadership. Like all of us, they didn't want boring meetings, and they didn't want to meet just to meet. And I've used this almost every time we meet. I keep this stuff in mind. And in fact, we don't meet very often. We do a lot of stuff in subcommittees and by email because I know how much people, how many meetings they have on their calendars. So once you've got those great people on board, how do you engage them and how do you keep them coming back? And again, this sounds like really basic stuff, but when people are making a decision about whether they're going to come to a meeting or not, this could make a difference. The meeting ambiance and the effectiveness. So I'll get to the really important information, and that's the snacks. Just having some healthy food out there that keeps people energized. You don't want to put a lot of sugary stuff or unhealthy food out there that saps energy. And don't underestimate the power of caffeine. Some coffee and tea can energize a group for those people that partake. And I'm a big believer in physical activity breaks. This is one of our early coalition meetings, and I'm leading a stretching break. And it's become a tradition for our group. Another great way to introduce fun physical activity into meetings is something called Go Noodle. This is actually designed for schools, but I find that it translates very well into adult meetings. They're a lot of fun. And I think you'll find when you give people these breaks, their brain power is stronger when they come back, their energy is brighter, and they usually have a smile on their face by the time you get done with the physical activity. Another very basic thing is room setup. I was recently in a meeting where the chairs were classroom style, so nobody was looking at each other except the person up front. So you can see here this was one of our working sessions, and everyone can see everyone else. And now to creating a culture of effectiveness, how to do what you have set out to do. I'm a big believer in having some early wins when you work with a group. If you start a project that's going to take 3 years to complete, you might lose a lot of people on the way. An early win will help you see how you work together, energize people, and help people feel motivated to continue. Delivering on promises. This is the leader and the members too, that people do what they say they're going to do. Because if one ball gets dropped, it can affect the whole system. I always like to accomplish something tangible at each meeting, to say very clearly, so at this meeting we decided on the policies that we were going to promote for the district school wellness policy. And then celebrating what you've accomplished. You, instead of just always slogging on through the work, taking the time to really sit back and appreciate the work that the people have done. How do you create the conditions for people to be useful? I believe that people really want to be helpful. So what I do is I'll ask people to do specific tasks. Can you review this handbook for us? Can you do some research on healthy concessions in other cities? Give something very clear that you know fits their skill set. Also having action steps at the end of the meeting and printing action plans to keep people on track. Talked a little bit about using time wisely, starting and ending on time. Make the agenda so it keeps you focused and participatory. So you're not just having a sit and get meeting, you're inviting the people to be a part of it. Keep things off the agenda that you can handle through email, and don't go into long conversations about something that affects only a few people. I've been in meetings where people will have a big conversation about getting something to the printer. Not all of us have to sit in on that. And if you've got 30 people in a meeting and you spend 2 minutes chatting about something that's not relevant to everyone, you've wasted an hour of time, 30 by 2, towards your effort. And then finally, evaluating every meeting. And what we have found is rather than doing a scale of fair, good, excellent, whatever, we do a more qualitative approach. And we ask people to write on a piece of paper, what will you say about this meeting when you walk out of the room? And we all do that. We go back to our office, we go home, and we say, I went to this meeting and, oh my gosh, it drug on and on. Or, oh, somebody just dominated. Or, oh, it was so exciting. So we have found just asking that simple question gives us information that allows us to adjust our meetings so they're better for the next go-around. And then just keep in mind that just good manners help in a coalition setting. Everything your mom taught you about being cordial, including new people, showing your appreciation, having a lot of integrity, that will be the foundation that will allow you to have a healthy group that makes a difference. So thank you very much, and I will pass the baton on, or the microphone on now, to Lacey.
Hello, everyone. Hope you can hear me. Again, my name is Lacey McNary, and I'm thrilled to be talking to all of you today. Basically, I'm going to be reiterating some of Anita's points and adding some examples from our work here at Kentucky Youth Advocates. Okay, there we go. So Kentucky Youth Advocates, as I said, is a multi-issue child advocacy organization, and we work on several different coalition efforts. The one I'm going to talk about some today is called the Kentucky Oral Health Coalition. Some people on the line serve in leadership capacities with this coalition. Some people might be members and some folks might not know about it yet. But basically our mission is to improve the oral health of all of Kentuckians. It's a relatively new coalition. It's about 3 years old. There was a coalition in the 90s, in the early 2000s, and we have reinvigorated this coalition. We meaning the members of the coalition, not just Kentucky Youth Advocates. We have over 60 members from all across the state with very diverse backgrounds. We have dentists, hygienists, school nurses, family resource people, parents, school leaders, teachers, various groups who are involved with this coalition. And we're also tied to a national movement on oral health with the DentaQuest Foundation. We have, there's coalitions like this in probably 36 other states. So we have very good company around the state. Our 3 priorities are improving school-based health services, which Linda Pointer leads that work group, and she's on the call today. We want to improve oral health literacy in Kentucky among parents and child care providers and teachers. We also want to increase the number of dentists who see children and who are on Medicaid. So we have some tall orders that we're working on. And just to let you all know, we're having our annual meeting on July 25th. We hope you all come. You can go to our website and sign up. Another big coalition that we kind of house here at Kentucky Youth Advocates is the Blueprint for Kentucky's Children. This is an 8-year campaign, so it's a little bit more established coalition. Basically, legislators a few years ago came to a lot of child advocates and said, you all need to get together. Every year we get 300 bills about children's issues. We don't know which is good, which is bad. Sometimes they compete with each other. Can you all come together and come up with a consensual legislative agenda, kind of like the business community? And so we took that to heart. And so that we are on our 8th year of convening child advocates all across the state. I hope some of you are involved in that. We have been very successful over the past 8 years. We've gotten the dental screening bill passed, booster seat legislation, got child care subsidy money put back into the budget, accomplished some juvenile justice reforms, and some simplification of our Kentucky's Children's Insurance Program, KCHIP. Right now we have a survey out to get input from all of you and anyone who cares about children's issues on what we should prioritize in the next session. So please check out the Kentucky Youth Advocates website to fill that out. The other coalition that we serve as a backbone organization to is called Face It. It's a 10-year campaign in Jefferson County that's designed to bring community partners together to end child abuse. It's a tall order, and it's sponsored by Cosair Charities. And what we're trying to do there is to educate professionals about signs of child abuse, create awareness of the problem, and support and drive policy change to end child abuse. So I'll be using these 3 coalitions as I go through this presentation. We really believe at KYA on John Cotter's view of leading change and guiding coalitions. He ascertains that there's 4 main qualities of an effective guiding coalition, as you can see up on the screen there. We all have been in situations that he describes called going it alone, the isolated CEO. And Anita kind of alluded to this earlier, just do everything myself. While sometimes it seems like, working with coalitions, you kind of do want to do that, but we all know that's not the most effective way to get change. Also, running on empty, the low credibility committee. I'm sure a lot of us have been involved with this. I remember in years past, several coalitions, we'd say, oh, we really need to get Senate President David Williams on our side, but we didn't have enough credibility to even get a meeting with him. So those are just some examples of things that don't work. We always want to make sure we have someone on our coalition that has a position of power. In case of the Kentucky Oral Health Coalition, we want to make sure that we have dental professionals at the table because we don't want to be promoting changes that are going to conflict all the time anyway with those who are in the positions that we're trying to change. Expertise. We want to make sure that we have lots of people who have expertise in various things, whether it's public policy, government, health literacy. We need to make sure that they're at the table. Credibility. We need to, for instance, with the Kentucky Oral Health Coalition, it's a relatively new coalition, so we are in the process of building up credibility to show that we are able to get things done and bring people together, whereas the Blueprint has really built this over time with consistency, big wins, and inclusion of folks. Face It campaign has built credibility because of the players they have involved in Jefferson County, really bring a lot of credibility to the work. And then in terms of leadership, this is a key to drive the coalition work. We need to have enough leaders to drive the change process. And I'm going to have to hurry up here if I'm going to stay within my 10 minutes. This is a great slide. Just says, people don't believe what you tell them. They rarely believe what you show them. They often believe what their friends tell them. They always believe what they tell themselves. What leaders do, they give people stories that they can tell themselves. Stories about the future and about change. So basically, I just want to let you all know you're all leaders who are creating positive change in your communities. It is you who are doing this. Why do people join coalitions or tribes, as Seth Godin refers to it? You can kind of see, if you look through this slide, the word social is in a lot of the categories, actually all of them, which tells me that relationships are extremely key factors in successful campaigns. Social connections are huge. We want to feel less alone in our work. We want to connect with others, share experiences, and develop relationships. I've definitely seen this with every coalition that I've been involved with, and I'm sure you have too. Membership retention. This is basically showing some impact reports with Kentucky Youth Advocates, and I like the way AmeriCorps put theirs together, and then the middle one is the Kentucky Oral Health Coalition. I think success is a great way to retain members. Big and small wins, sharing the limelight, enumerating wins when possible, which you can kind of see with these great infographics. It's a great way to share impacts, outcomes, results, and wins. I think using stories and graphics is a really compelling way to do that. You can kind of see later if you click, if you go to find these online, that the middle one, since it's a newer coalition, it's a little bit more general in our successes because we're new. If you really studied the Kentucky Youth Advocates and the AmeriCorps one, you would see some big wins included on those. So back to Anita's point, getting stuff done. This is a cheesy little graphic of a tool that we occasionally use to check in on accountability. I have it on my desk, so when I'm feeling like I'm, maybe not pulling my end of the deal or need to check in on my own accountability, I kind of see where I am on this accountability pathway. We've learned that, stating publicly what you're going to do during a meeting really helps to contribute to the results and hold you accountable. So maybe you might want to say, where am I today on this project that I'm supposed to be working on? Aligning priorities to reach goals. For instance, with the Blueprint for Kentucky's Children, we find that when several groups can align their priorities together, the results can really be amazing. I think the Blueprint is a terrific example of this. Obviously, when people have passion and their work aligns to deliver the results, it's a match made in heaven. Sometimes we have to do advocacy with our partners, though, to kind of get them on board. And with the Blueprint, we do this by having a steering committee where people can bring ideas and proposals to the table, and then the survey that I alluded to earlier, which is designed to elicit lots of people's feedback. And then we have work groups who can then take these things and offer feedback. So we never want all the ideas to come from the top. It needs to be spread around with the members. Lastly is to model accountability. I just wanted to reiterate the importance of doing what you said you were going to do. It also talks about, speaks to the importance of working on issues that are real problems by looking at data, not just anecdotal things. We believe that this is a powerful tool to make meaningful change. It's also a way to be accountable to your funders and to the people of Kentucky. So you might want to think about ways to have people that are impacted at the table. That's another way to be accountable for your actions and your work. And we do this in different ways with Kentucky Youth Advocates and the various coalitions, whether it's actually having folks at the table or doing focus groups to bring their voices to the table, or asking the professionals in the room to make sure when they go home to talk to folks, to bring their voices back. And I'm going to have to hurry up here to meet my time. Finally, accountability is just the glue that ties commitment to the results. Being transparent, getting equitable engagement and participation, being reflective and deliberative, and allowing folks to call you out on your stuff, and being able to be assertive enough to either do that yourself or take the feedback. And finally, I thought this slide was really great. Quit the wrong stuff. Stick with the right stuff. Have the guts to do one or the other. Again, you are the leaders that have the power, passion, and tools to get stuff done for Kentucky. Together, we can make Kentucky the best place to live for everybody. And I am done. I'll pass it on to Peter now.
All right. Thank you. In thinking about energizing coalitions and in talking ahead of time with Anita and Lacey about this material, it seemed like there were some lessons that actually went along with a story I'll share with you from a project I did several years ago in Siberia. So I'm calling this Lessons from a Siberian Volleyball Court. I've been asked to come to this small village in the middle of Siberia to help folks do something to jumpstart their community, and that was a tall order. And so the first lesson was that we needed to bring people together around a common goal. In the left-hand side there you can see the school building, which was the biggest building in the village where we held all our sessions. Now, working in this little village in Siberia was in some ways easier and in some ways harder than the work you do in your communities here in Kentucky. It was easier in that this was a village of only 300 people, so we could bring a lot of that village together in one place. It was harder in that this place truly was in the middle of nowhere with 90% unemployment and some real difficult problems to face. So we started by bringing people together, and you can see on the looks of the faces there in this first meeting, there was some suspicion about just what exactly is this we're up to. But these people were committed to their community, and they wanted to see something good happen. So lesson 2 was to develop shared priorities, and you don't need to read Russian to know what you're seeing on these flip charts. On the left-hand side there, that's obviously a brainstorm. They're throwing out ideas, and on the right-hand side, we began to prioritize those. Now, the ones in green that have only got a few dots, those were ideas they came up with the first day when they were just really kind of scratching their heads about what is this idea of doing something. We knew we were going to have to do something to make a showing to get that group energized. But the second morning, somebody came in and said, you know what, I had this idea. Maybe we could build a volleyball field here in the village. And that's that one in purple, and you see all those red dots. They've got a lot of energy going around that idea of putting together a volleyball field. So on the second day, everybody came back after lunch with their shovels and their picks and ready to go to work. And that's lesson 3, build your team. And this was our crew that went out there and really dug in to start doing the work. And lesson 4 is about getting to work. You've got to make a showing. You can't just stand around and talk about doing stuff. My good friend and mentor, Vaughn Grisham, who tells the story of Tupelo, Mississippi, says, you can't bring people together for a planning process and spend 6 months just planning. You'll wear everybody out. They'll lose all their energy. You've got to get started doing something right away, and that's what's going to keep people energized in that process. So we got out there, we got to work, and in fact, somebody came to me that afternoon and said, they're saying this is the first time they've ever seen an American actually work with his hands. And there's a little leadership lesson there, too. Be sure you're getting your hands dirty in the process as well. Lesson 5, use the resources that you've already got. Now, somewhere in that afternoon, this kid showed up on a motorcycle with a sidecar, and he had the two metal poles that had the pieces welded onto them to tie the net to. I don't know where that metalworking shop was in the village that they were able to do this, but they had that resource. And just like making stone soup, when people start putting their energy together, the resources that are already there on the ground will start to appear. Lesson 6 was creative problem solving. Nobody in the village had a post hole digger, and if you've ever tried to dig a deep hole with a shovel, you know that you get down so far and you can no longer lift the dirt out of the bottom of the hole because you can't turn the shovel at the bottom of the hole to lift that dirt. So they handed this kid a little metal pan, and they held him upside down, and they'd dunk him down into the hole, and he'd fill that pan, and they'd pull him back up out, and you can see on the right-hand side they're measuring to see if they've got that deep enough yet. They were all having a pretty good time with that. Lesson 7, you have to use the inside resources, but then go after the outside resources that you need to do the work that you're trying to do. There was no volleyball in that village, and there was no net. So there were only 2 cars in the village. My colleague Jennifer, who's in the blue jacket on the left, hopped in one of those cars with one of the villagers, and they drove about 2 or 3 hours to the nearest place where you could buy a net and a volleyball, and they came back by the end of the afternoon in time to get that net strung up. Lesson 8, celebrate your success. And you can see there they all are out there on their new volleyball field with the lines limed and the stones cleared away, and they're playing volleyball, and about half the village was out there watching them. And you can see the crowd that we've got by the end of the day just to get the picture taken. That wasn't even everybody that came out. Well, what happened? That generated a lot of energy. Having that success, and you can see the difference on the faces here from that first day. They're ready to go. And when they came in the next day, they just wanted to know what's next. And the ideas started flowing, the energy was flowing, and the commitment to do something to move their community forward. So those are some lessons from a Siberian volleyball court about our work in energizing that local coalition, and to do a discrete project, and as a result of that work to then be ready to move on to bigger projects and bigger successes. So with that, we wanted to move into some conversation now. I've got a couple of questions for Anita and Lacey, and of course, I hope some of you all will submit questions through the chat function as we're having a conversation here. But Anita, I want to start with you. You mentioned vision as an important part of coalition leadership. What do leaders need to do to help a group come together around a shared vision? And Anita, I don't hear you. You might still be muted.
Can you hear me now?
I can.
Great. I think a good way to start is to have a group visioning session, and that is to invite people to a nice location with a good amount of time to actually dream about what could be possible, and sort of like the pictures you had in Siberia of flip charts and writing notes and brainstorming. I think a lot of good ideas can come that way, and the vision can start to crystallize. I think it's also good to look to other communities that have been successful doing the kind of work that you're interested in. And we did this with the Good Neighbor stores. There's work that's been done in Baltimore on these types of stores, and we went to the guy who is the expert in the field and had conference calls with him. If your budget allows, taking field trips and actually going to see places. And we did that. We went to Louisville because they have Healthy in a Hurry stores. And we actually brought 4 different groups to see what they had done. And in fact, we brought one store member with us on one of the trips. And on the way to Louisville in the van, he said no, he wasn't going to put a new clean floor down in the store. And on the way home, he said he was. And he in fact did. And it was just seeing what these other stores had done. So those are a few ways to get the group having some idea about what's possible.
You know, sometimes that vision is something that you all have to imagine, but if you can place that vision in front of people in a tangible way that they can see it, as you say, sometimes going somewhere else to see what's been done there, it can make a huge difference. Lacey, you talked about teams and tribes in your presentation. In practical terms, what do you do in a coalition to build and maintain the team? And how do you think about balancing the work of team building with the work of forging ahead to get the work done?
Thanks, Peter. I think that a lot of the things I would say have been said, but some of the ideas I have are, make sure you're keeping the work and the priorities relevant to what's going on at the time. I think Anita talked about making sure people have something to do. There's some delegation going on. I think listening, truly listening to folks, and a lot of times we all come to meetings with our own kind of agenda and preconceived notions, and I think just being open to hearing what others have to say and being open to maybe changing, what you wanted to do based on, what you're hearing in the group. Asking and building partnerships. So asking folks to join in and, making sure that people feel like they are actually contributing to the goal and not just there. And then I think kind of what I mentioned before, I think thinking big and then also thinking incremental. I'm sure a lot of you know that in Kentucky sometimes change has to be incremental, but you should also keep your eye on some big goals and some big visions that you would like to change. So I would just kind of add those to that question.
That's great. And this may be an appropriate follow-on to that. We have a question that came in on the chat queue, and I'll just mention if others of you have questions that you want to send in, please put them up on the chat. But we have a question of whether you would recommend rotating officers of a coalition on some kind of defined basis in order to bring in new ideas. Anita, Lacey, what do you all think about that?
I think, this is Anita, I think it's good to rotate officers. I don't know about a defined basis. I mean, I think you could set some standards, but I also think there's nothing like watching what's happening and making decisions, like, things are starting to get a little stale, and letting the conditions in front of you set the timing. That said, I also think it's very important to keep some longtime members in leadership positions so you have that institutional memory. So when somebody comes up with a new idea, somebody who's been with the group for a long time has the history to put that into some sort of context for the group.
Mm-hmm. I would agree with that too, Anita. And I see that my friend Linda has written the question, who I said is chairing our school-based health group. So I hope you're not saying you're trying to get off the committee, Linda. But anyway, no, I do think that having folks who've been around, is great, and they have that passion. I've noticed that with our Oral Health Coalition. There's a core group of extremely passionate folks who've been involved for a long time. And then we want to make sure that we're involving others who are maybe new to this. We think about oral health now 24 hours a day, but a lot of people aren't thinking about this. And so part of what we want to do is build awareness of why everybody should, care about this issue. But I do think getting new people on, and we, like for our executive committee, for instance, of our Oral Health Coalition, we want to make sure that we don't just have dentists and hygienists who are on that committee. We want to make sure that we have, people that represent other viewpoints on that. So we're making sure that our leadership is looking at the problem from lots of different lenses.
Yeah, the one thing I would add on this question is that you shouldn't think of the officers as the only way for people to exercise leadership in the coalition. You should have lots of opportunities. Don't bring people in and expect them to just come to meetings and sit there. Give them something to do as soon as you get them on board. Give them a role. Give them a project to work on so that you're engaging people. And then that question of whether this or that person is an officer becomes less significant.
I totally agree with that.
We've got another question that came in about how can we revitalize a coalition. So, let's say you've been doing some work for a while. It's kind of fizzled. We've all been through that. You know that the energy that got you started up, maybe the situation changes. What do you do to revitalize a coalition?
Well, this is Lacey, and I kind of mentioned that the Kentucky Oral Health Coalition did exist in the past, and a lot of those passionate folks are involved with this new iteration. From my understanding, what happened in the past was it was a lot of volunteer work, not a lot of funding, and I think people just kind of got a little burnt out, so it went away for a few years. And kind of like what Anita said is I think getting a grant or an infusion of funding, personally I think that's a great way to revitalize a coalition. And it also allows a group to be what they call a backbone organization. If you could find someone to kind of do the boring work of like scheduling the meetings, writing the notes, that sort of stuff, I think that keeps people engaged and feeling like they're really making a difference.
Hey, Lacey, or anyone else on the call, would you mind giving your definition of what a backbone organization does? I hear it a lot, but I'm not sure if I can give the definition.
I can. From my perspective, I don't know if it's the official Webster's dictionary definition, but in our case, it means that we kind of do what I said is like, we make sure the meetings are scheduled, we make sure that the notes are done, we make sure that there's, the meetings are well prepared, and kind of do like the member recruitment. We do a lot of the back office sort of work, so the members can come and lend their expertise and that sort of thing. That's kind of how I view it. I don't know if Peter or Anita have a different definition of that.
I think you've said it well.
Yeah, that sounds right to me. I would like to go back to this question of revitalizing a coalition, because I think there are two things about that. One is that you may have to do a lot of the things that you would do from the very beginning. You might have to bring people together to renew that shared vision. You might need to bring in new energy and new people into the group. But the other thing is that sometimes it's time to lay something down. If the energy for a piece of work has run out, throw a party, have a big celebration, and thank everybody for what they did to contribute to it, and close it out. And then be ready to start something new. And when people feel like there's been closure and they've been honored for what they did before, they may be more ready to start something new, and that may be easier than trying to breathe new life into something that's pretty much run its course. We have another question that's come in from the group, and I think we've got time for this one more here. Let me generalize this a little bit. They talk about a potential glitch that you can run into if participants share a common vision, but then certain participants maybe have some specific interests that restrain the scope of the goal. Maybe they have some interests related to some entities that are affected around maybe controlling costs or increasing profits, because you've got a bunch of different interests when you bring a coalition together. So if a group restricts its goals and that minimizes the change that you can actually go after, how do you deal with that sort of disparity of interests and how that can affect a coalition's effectiveness?
Well, I can talk about that. Oh, go ahead, Anita.
You go ahead, Lacey. You probably have more experience, and then I'll follow up after you.
Okay. Yeah, this has been interesting. As a child advocate on a coalition, my main, thing I bring to the meeting is making sure that children's issues are addressed first and foremost. And maybe a dentist who would come to a meeting might have a different, focus area, or I think you have to honor that, and I think you also have to build the trust. There's got to be some common ground issues that you can work together on to build that relationship. So the next time it comes around that maybe you don't agree on things, you have that relationship to work it out. And I mean, as an advocate as well, we just don't agree with some people on some things, and that's, we have to kind of agree to disagree and find common ground and work on those things together.
Anita?
I think what Lacey said has covered it well. Well, I'll add one thing, and that is I'm a big believer in putting things out on the table and having a conversation, and perhaps doing that privately with a couple of people, finding out really what's important to them, and then looking at that array of issues and seeing if there's any common ground, if there's any way that you can satisfy some of the desires of both groups. But I think really sitting down and talking about it, and you might not do that in the big meeting. You might do a smaller group to look at those, and then seeing where there's convergence and seeing where there's not, and trying to work it through the best you can.
So really good points. You've got to build the trust and the relationships that are going to sustain the connection. And it's important to remember that even though coalitions may represent organizations coming together, it's really people working together representing those organizations. So you've got to keep those human relationships strong. And you've got to have those difficult conversations, just like Anita said. The other thing I would add to that is that a coalition is one kind of tool, and it's not the only tool. It's not the best tool for everything. Sometimes you want a really broad coalition because you need the power that that broad coalition will bring. But you have to accept the fact that that's going to limit the focus in some ways. It may limit the scope in some ways in order to create that bigger umbrella. You may have to compromise on some of the objectives that individuals or organizations would bring to that. Sometimes you need just a partnership or a very small group to work together on something that has a high degree of alignment on a set of issues so that you can push those as far as possible. And the trade-off there is that you won't have as much power as you would with a larger coalition. So it's a matter of finding the right tool in your toolbox to get the job done. Anita, Lacey, any last words before we kick it back to Rochelle?
All right, thank you so much. This has been a really exciting webinar. I'm honored to have our three presenters, Anita, Lacey, and Peter, on the call today. They bring a lot of experience, a lot of troubleshooting, and some great strategies that we can employ in our coalitions. I want to thank all the participants for joining us today. A reminder that this webinar will be posted to the Foundation for a Healthy Kentucky website so that you can see all the PowerPoint presentations and also have the contact information for each of our speakers today. This afternoon you'll receive an email with a link to the post-event evaluation. Please kindly take a few moments to complete the evaluation and let us know what you thought about today's webinar. The evaluation will also allow you to suggest other topics for future Health for a Change trainings. I welcome your suggestions. Upcoming in September, the Foundation for a Healthy Kentucky is sponsoring the BOST Health Policy Forum September 16th in Louisville, so I invite you to sign up for that and join us at that free conference in September. Finally, I want to thank you for your participation. This is an important training function that the Foundation serves, and we're honored that you're on the call with us today. I look forward to continuing our work of advancing the mission and addressing the unmet health care needs of Kentuckians. Thank you all so much. Have a great afternoon.